Afternoon, everybody, and it's nice to see so many of you logged on today. And of course, we will be discussing a bit on COVID-19 today. And as most of you are fully aware of the condition now, but there are still some questions that are left unanswered and things that people are having difficulty with. And we'll try to address these during the course of today. So I would just like all of you to maybe put your videos on during the course of this discussion. And also, if you have any questions, feel free to stop me at any time. And just by raising your hand, and we can address your questions, and that will help the discussion, and it will help us to cover more of this topic. So, of course, I'm going to go through some of the things that are just known to most of you. And we will see where this takes us. So we will start with a short prayer. And then we'll get straight into it. So Om Sahana Vavatu Sahano Bhunaktu Saviryam Karvavahe Tejasvinava Ditumastuma Vidvishavahe. Om Shanti 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 Shri Gurubhyo Namaha Hari Om. Okay, so looking at what has happened throughout the world, and especially in South Africa, it has become more and more alarming to witness the trend as far as COVID-19 is concerned. About 2.5 months ago, I revealed to many of my patients and to many of my friends and that I had discussed the condition with them, and I had let them know that at that stage that I felt that the COVID-19 virus had mutated based on what I was seeing in the large number of patients, COVID-19 patients that we were treating and examining. And so, of course, 2.5 to 3 weeks ago, the scientists verified that indeed there was a mutation of the virus, and there is a mutation of the virus now. And so things have changed a little bit from how it was. And I also think that this virus is no longer going to ground very quickly as it did in the past because of the heavy particles. And it seems that the virus might actually linger in the air for between 30 to 40 minutes as well. So the masks that you wear become doubly important, because it's possible that when you enter supermarkets or places where there are a multitude of people, that you would be walking through a fine spray. And if your nose is uncovered, etc., these are the times when you can inhale the virus. And this would explain why we are having outbreaks in clubs, in rage parties, etc., because it's just not boiled down to immediate face-to-face contact. And also, you'll find that, sharing of utensils, large parties, all of these have become a problem. So I'm going to go through this discussion in a little bit of a structured fashion, and we'll tackle each one as we go through, and we will see what questions you have at that time. So SARS-CoV-2, COVID-2 2019 is the fourth human coronavirus. And coronavirus is largely found in the pangolin bat species, and it's prevalent in those species. So the jump to humans happened was identified first in 2002, when the first SARS-CoV virus was identified. Fortunately, it wasn't overly infectious, but the alarm bells went off and there were some restrictions that were imposed, and this virus was contained. Shortly, or a few years thereafter, MERS, the Middle East Respiratory Syndrome virus, also a coronavirus, attacked in the Middle East and was also contained there. For a short while, they had SADS, which was a swine acute dysentery or acute diarrheal syndrome. And this was transferred from pigs, but that itself was also contained. Now, as of 2019, the SARS coronavirus 2 jumped into humans again, and this time it was severely contagious, seemed to have originated in Wuhan, China, and spread to the rest of the world. So, of course, we all know about the epidemic. Many people have been keeping stats and following stats. I personally don't follow the stats too closely, although I'm going to discuss some of it now. And the reason for that, I'll explain a bit later. In South Africa at the moment, we're sitting at 1.07 million infections today. And we've had 28,887 deaths. And there were an additional 418 deaths overnight. So the death toll is climbing. And the difference I've seen from the mutation, with the mutation from the initial virus that we saw in large numbers in the middle of June, is that the death rate seems to be climbing. More people are ending up in hospitals. Unfortunately, we now have a situation, and I also run an emergency department. We're in a situation that none of the hospitals along the entire coast have beds. So if a patient becomes critically ill, they are left without hospital services. And how is it that we are now going to deal with this situation? Because by now, most of you have lost friends, you have lost family members, or you heard of somebody that's passed away that you knew. So this virus is no longer something that's happening far away. It's happening in your own home. It's happening in your own space as well. And a lot of fear is ravaging society now because people don't know what to do. They're afraid that should they get the virus, they will not have access to emergency care and to hospital care, which is really the fact. All the ventilators are full, are in use. All the oxygen points are in use. And this is not only in the private sector, this is also in the government sector as well. So there are huge queues outside of hospitals. Ambulances have been asked to take the patient back home because there's nothing that can be done for the patient. So how do we prevent ourselves from getting into this place in the first place? And, there's been this emphasis on masks and sanitation, and yes, it is the mainstay of prevention. But there are many more things that we can do. So firstly, let's look at what are the symptoms of an infection. Now, largely, the symptoms are very innocuous. They are prevalent in other conditions, including the flu. So sometimes you might find that you're not sure whether you have the flu or not. So the common ones, or the ones that really indicate or are more prevalent, are fever, cough, and tiredness. Of course, these are vague symptoms that can be there for any number of reasons as well. Then you get less common symptoms like body aches and pains. You may get a sore throat, diarrhea, conjunctivitis or redness of the eyes, headache, loss of taste or smell. Now, this is peculiar to this condition, the loss of taste. The loss of taste and smell is peculiar to this condition. It is not exclusive to the condition, but if you have these symptoms and you went for a test and your test was negative, but you definitely have a loss of taste and smell, please be aware that your test might be falsely negative. and it might be necessary for you to test in a day or two later. So be mindful of this fact, because the mechanism of action of this virus is such that it causes swelling of the mucosa around your nerve. And so this is responsible for your loss of taste and smell. The other thing that can happen is discoloration of the fingers and toes. This is not a good sign, because usually the fingers and toes become blue, which means that you're not getting enough oxygen. And this is the main mechanism by which people lose their life. And then you might have rashes on the skin. So if you have any of these symptoms, or a combination of those symptoms, your alarm bells should start ringing, especially if you've been in contact with somebody with similar symptoms. So how do you know whether you have coronavirus or not? Well, one, firstly, you might find yourself waking up on a different planet than this one. Or you might have no symptoms at all, or you might be somewhere in between. So coronavirus has this, many people have recovered comfortably from coronavirus with very minimal symptoms or no symptoms, and they've been perfectly fine and wondered what all the fuss was about. Unfortunately, many people haven't survived. And it's those people and you that are currently alive that we're concerning ourselves with, because, it's not easy to lose loved ones, and it becomes a very uncomfortable situation when you have to choose between nursing somebody at home and having them admitted to hospital, knowing fully well that many, many people who enter hospital never return. And the last time you see them is when they go through the doors of that emergency department. So what is it that we need to do? How serious is coronavirus? There are people out there that are saying that this virus doesn't exist. It's actually a bacteria, or it's, social media is bombarded with a lot of ridiculous information. Coronavirus is real. It is a virus. It is serious. And it is life-threatening. Now, even if 3% to 4% of the people affected die, we are talking about large numbers of people, large populations. So that becomes an enormous amount of deaths. So when does it originate and how does it originate? Well, largely it's due to exposure, and the onset can be anywhere between 3 to 7 days after exposure, but there have been cases where the exposure is long as 14 days. It depends on your own immune system. So obviously one has to be fairly careful and vigilant when you go out. And especially when you're in supermarkets, when you're out of your home, well, the best thing is to be at home, but obviously you need food, you need provisions for yourself, and you have to go out because of that. And when you do, and when you're at work, I think largely you should come back straight home, get into the bath, get out of your clothes and get into the bath, wash yourself. And the frequent use of soap, the frequent use of sanitizers reduces your chances of spreading things to people within your family. Now, sometimes people are in high-risk professions and they come home and they start rolling around the couches and they start rolling around on the beds, etc. And you are just passing this virus into your household, and you're putting other people in your home at risk as well. So when you find that you have a symptom, or people in your vicinity or in your household have a symptom, the first thing you can be is try not to be negligent. If these people are symptomatic, you should never go out and interact with other people because you are not symptomatic. If you are living in a household and somebody is symptomatic, it means you also have to stay at home. You should not assume that the symptoms are nothing And especially if you know that you are going to send somebody for a test the next day, you certainly should be very, very clear about being at home and waiting. Because you see, you might get coronavirus and you might survive, but in the process, you might infect somebody else who doesn't. And your negligence can cost a life. And very often it is costing the life of healthcare professionals. It is costing the life of nurses. It has cost the life of doctors. And these are the people that are your gateway. These are the people that are in the front line, trying the best to get as many people as possible better. Because unlike most other people, the healthcare professional is duty bound. Many of them have shied away from the ethical responsibility, but there are many, many professionals out there that really every day go to work not knowing what would happen at the end of the day or in a few days' time. Because for myself, I'm exposed every day, sometimes and a number of times every day. So, of course, we take every precaution that we need to. And some people who have been quite cautious have still contracted this disease. And the outcomes have been, right now I have a number of patients that are really on a touch and go situation. Their condition could go in either direction, and we might not be able to do much for them when that happens, because we aren't able to escalate their treatment. Okay, so what are the current treatments out there? Well, in South Africa, we have vitamin C and zinc and vitamin D that's been proposed by the Department of Health. And every country has done this. They've have recommendations. Now, remember that these recommendations have severe limitations. It doesn't mean taking vitamin C and vitamin D and zinc prevent you from getting coronavirus. Neither are those substances able to kill a virus off. So it's purely meant to boost your immune system. And really speaking, if you take an excess of these vitamins, they cause more harm than good, especially affecting your digestive system and your skin, etc. Well, the main country that we look at in these times is obviously the United States of America, who have the largest infection rate, and they have the most expertise based on the numbers of people that they treat. And if you look at information coming from the Harvard School of Medicine, as well as Boston College of Medicine, they are the pioneers in this field, and they are using special types of drugs derived from the plasma of human beings. And these have been approved by the FDA, which is the regulatory authority in the United States. And they're using bamlanivimab, casivimab, and imdevimab. So those products are not available in this country. And even with those products, there's limited efficacy. And it's meant to be used in mild to moderate cases. That is prior actually to hospitalization. Now, the problem comes is when you reach the stage of hospitalization, what can or cannot save you? So there was a lot of talk of remdesivir being used. And so there was a whole run of remdesivir for a few months. Even up to now, many of the physicians in hospitals, out of desperation, are using remdesivir, but the outcomes are still the same. Because when the patient gets to a certain point, none of these drugs work, and the patient declines and gets worse, and nothing helps them. In fact, almost 90% of people who go on ventilators do not survive. So many patients get into hospital, they get onto oxygen, and they get better, not because of remdesivir, because the World Health Organization then did a retraction to say that remdesivir is not as effective. Then there was the use of dexamethasone, and dexamethasone is still useful. It's still helpful for patients who are in a very severe, we call that a cytokine storm, when they're in a very severe infectious phase of this disease, where the body has sent out lots of antibodies to fight against the disease. Dexamethasone reduces the inflammation in the body at that time. And when it does, you do get some positive response in some patients, but not all patients. And again, there are certain factors that seem to be responsible for the patient doing worse and then the patient doing better. So in the past, initially when the disease came out, there was talk of chloroquine. And chloroquine was a drug used for malaria. And all the stocks of chloroquine and quinine got bought up in the country because people got desperate at the time. Again, ongoing research hasn't yielded any sort of result to say that definitely this product works against COVID-19 or prevents COVID-19 infections. There was a use of azithromycin as well, together with chloroquine. Azithromycin is an antibiotic. It has some anti-inflammatory properties which might help the patient. Or if the patient has a bacterial infection, then the azithromycin might help. But no antibiotic works for bacterial infections. So if you get coronavirus and you want to take Augmentin or azithromycin or any of those things, you are wasting your time. You're probably even lowering your immune system further. And this is one of the reasons for the talk today, is for us to evaluate what is out there, what are the discussions, and are there alternatives to treating coronavirus? So even vitamin D has to be taken in large quantities. Side effects become problematic, vitamin C as well. The latest buzzword or the latest drug that people are talking about as a breakthrough is Ivermectin. So I'm getting messages from everybody saying, can we get Ivermectin? Use your contacts, get Ivermectin. Ivermectin's been around for a long time. It's not a new drug. It was developed more than 20 years ago, in fact. And it was, no, longer than that, I think in the 70s. Ivermectin came about in the 70s. And it is used for conditions like filariasis and river blindness. So it's a parasitic, anti-parasitic drug. It was first used by vets throughout the world, and it was a blockbuster drug for vets because it helped to control parasites in animals, internal and external parasites. So the first indication for its use for human use came about when they found that it worked for a condition called river blindness. But it was at a dose of 200 micrograms per kg per month. So in Australia, they have an indication to use it at that dose 3 times a month. So where the excitement came was when this drug was tested in the lab, and they injected some of this drug into the cultures of COVID-19, and this drug killed off the virus. But for that to be effective inside a human body, you would have to take 10 to 60 times the recommended safe dose of that drug. So that in itself is associated with lots of toxicity, lots of problems, lots of drug interactions, and would potentially kill you, if not destroy your, because it's been associated with loss of or visual disturbances, so it might affect your eyes. So again, social media is becoming more problematic than helpful in this during these times, because there's a lot of false information out there and people are clinging on to straws. There's hope of a vaccine, but the vaccine itself is a problem, because this vaccine is brought into market at supersonic speed in terms of vaccines, and I'm involved in clinical research for a few decades now. And if you look at the way vaccines are developed, they take at least 10 years to get to market, because all avenues have to be explored before you give somebody a vaccine to make sure that it is safe, because vaccines are administered across a massive patient population. So, do we vaccinate or do we not vaccinate? Well, I would advise that we be cautious. I've been approached to participate in 2 vaccine trials, which I've declined because I'm not convinced on the ethics behind these things. And we're rushing a vaccine into human trial very, very quick. So some pharmaceutical companies tend to make a lot of money. I might be wrong, and these vaccines might work and have no side effects, but it's not something that we ethically can play around with, potentially causing more harm than good in people. So let's wait and see where these vaccines move, because if you understand, we have vaccines for the flu, which is also a virus, and that vaccine is modified each year because the flu mutates all the time. So if you can think about it, we have not found a cure for the flu as yet. The vaccines have not cured influenza. So I still don't think that a vaccine for coronavirus is going to present or provide a cure. Okay, so, excuse me, that's not a coronavirus cough, just a dry throat cough. Anyway, I hope so. So, what are ways of preventing the spread mechanically? Of course, we spoke about masks, we spoke about sanitizers, and these should never be far away from you. Never remove your mask because you're talking to a friend. Even if you don't have a mask on, try and be a few meters away. I think in South Africa, we all got used to talking loudly. So we can talk loudly from a distance, and it's safer. Don't assume because it's a family member or because it's someone you know that it's safe. Then be mindful of cleaning your surfaces. Make sure that you, if you have someone with coronavirus in your home, is to disinfect your surfaces, especially toilet handles, door handles, etc., and regular change of clothes. Now, we've had instances where one person has been infected in the home and the rest of the home have remained non-infective. And this is because people have taken the necessary precautions. Of course, we've had the other extreme where everybody in a home has become infected. And that is quite commonplace. But we see on those patients that have been taking advice and going into isolation quickly, that all of these things are reduced. So what is your responsibility? Your responsibility is to stay at home. And when do you do a test? Well, the other thing that's been causing a problem is that when people are exposed, they immediately rush off to the lab wanting to do a test. Now, this itself is a problem because you are cluttering the system, and we are waiting sometimes urgently for results of patients that are symptomatic, and so we can decide what their treatment protocol needs to be. And when you rush in there and you do a test that is in a window period of a condition, it's a worthless test. It is going to come back negative. It's going to give you a false sense of being free. And then you go out there and start infecting everybody else. And that's what's happened to a large extent in this country. So the first thing to do is to wait. You wait between 3 to 7 days for symptoms to appear, and then you test. If no symptoms appear after 7 days, you can still test before returning to work. If you are homebound, there is no need to test. Now remember, if you have a positive patient at home and you display symptoms and you are home-based, there is no real need for yourself to test. All you need to treat yourself as positive and manage yourself as though you were a positive patient. So the testing largely applies to people in the work spheres or those people that are going out to work with others. And of course, those needing admission to hospital. Just remember, more than 80 to 85% of patients will get better without any problems whatsoever. So we try and keep you in that group. So also remember that the tests and the accuracy of the tests are not 100%. So we have had many instances where patients have tested negative and been tested a day or two later and tested as positive. So if you have symptoms of coronavirus, if you have been examined and the doctor strongly feels that you have coronavirus and your test is negative, you shouldn't clear yourself to be back into society just yet. I think you should exercise caution, remain at home until all your symptoms have settled. Because as much as everybody is trying to save their own lives, I think we all have a responsibility to make sure that we save the lives of other people by not exposing them. So what are some of the alternative treatments? Well, as I said earlier, in countries, certain countries, there's advocacy of multivitamins and various other modalities to treat. And I looked at India recently, and the government has recommended Ayurvedic treatment for all of them. So what's the right way? What's the wrong way? So I'm just going to have a light-hearted small video here that we all can just watch, and then we will chat a bit more later.
இந்த தமிழர்கள் இருக்காங்களே, இவங்க ரொம்ப மோசம். அவங்க பக்கம் போகவே போகாதீங்க. ஏண்டா என்னடா ஆச்சு? மற்றவங்கள மாதிரி இவங்களே ஈஸியா போடலாமான்னு நினைச்சு உடம்புக்குள்ள போனோம். அங்க போன பிறகுதான் தெரிஞ்சிச்சு நாங்க இவ்வளவு பெரிய தப்பு பண்ணிட்டோம்னு. அவங்க உடம்பு சாதாரண உடம்பு இல்ல. நிலவேம்பு, ரசம், மஞ்சள், நெல்லிக்காய், கீரை, தேசிக்காய் இப்படி பல ஐட்டங்களை சாப்பிட்டு உடம்ப தெம்பா வச்சிருக்கிறாங்க. அவங்களோட இம்யூன் சிஸ்டம் எல்லாம் அந்த மாதிரி ரெடியா இருக்குது எங்களை போட்டு தள்ள. என்னாடி சொல்லதான் ஓடியந்த அங்கள பக்கம் போக வேணாம். இவங்கள மாதிரி எல்லாரும் சாப்பிட்டு வந்தா நமக்கு வேலை இல்லாம போயிருமே. என்ன பண்ணலாம்? இதோ வந்துட்டான்டா என் சிங்கக்குட்டி. நீ எத்தனை பேரடா போட்ட? எங்க வாச சும்மா போங்க. எல்லாரும் மில்லட் ஆயிட்டாங்க. கைய கழுவுறானுங்க, முகத்தை கவர் பண்ணி தும்புறானுங்க, சோஷியல் டிஸ்டன்ஸ் மெயின்டைன் பண்றானுங்க, வீட்டுக்குள்ள சேஃபா இருக்கிறானுங்க. என்ன இத நம்பாம கொஞ்சம் பேர் திரியிறானுங்க. போடுறேன்னா அவனால மட்டும்தான் போட முடியும். இப்படியே போனா நாமளா 2 கிலோமீட்டர் அழிஞ்சிருவோமேடா. சரி சரி போய் போடேலுமானாங்கள போடுங்க.
Okay, I just have to share my Tamil ancestry there, which shows you what strong blood we have. But anyway, it's part of the problem that we've noticed in South Africa is that there are people out there that believe that they are indestructible and that their blood is very strong and that they can't be attacked. And this again is misinformation or misbelief, and it will only end up in more tragedies. So what are some of the alternative ways in which we can treat this condition? Should we get the condition, and should other people in our families or friends or any of our friends get this condition? What do we do? So largely my patients, I've asked them we've started to treat them very holistically using natural treatments, using Ayurvedic treatments, and it seems to work extremely well. Even patients who have been really, really seriously ill and they've taken these advice, they have done extremely well. So I don't want to claim anything scientific from it, but I can only make these claims based on my own experience. Many people end up in hospitals. Many of the doctors out there are panicking in treating these patients. There's a rush to ventilate some of them, which have very poor outcomes. Patients are dying. All these drugs that have been pumped into your system to a large extent are also weakening your system further. And then you have the chance of super infection within a hospital. I mean, we are working in the hospital, so we see how many of the staff are tired. They are scared themselves. And so attention to detail starts failing after a while. So you can find that many, many people are being super infected. And that's why the recovery rate in hospitals is also low. Of course, these are the most serious patients, and the chances of their recovery is also lower. So largely you get to hospital when your oxygen saturation is low. You'll find in this condition that you don't start gasping for breath until your oxygen saturation starts falling low into the 80s and below. So you can sit with an oxygen saturation of 92 and be quite comfortable, even 88 sometimes, on room air, and the patient is comfortable, he's not battling to breathe, etc. And these patients do well with just a little bit of oxygen and they can pick up, because your normal saturation is between 98 to 100%. So, and then those patients that start dropping further end up in hospital. Now, many, many patients think that they can manage, and then they get to hospital very late. And by the time they get to the hospital, it is actually too late to intervene, because firstly, we can't get a space for them. But if we do manage to get a space with some oxygen, the patients deteriorate quite rapidly. So some of the things, the general measures that are found that are useful in managing these patients is, one is the patient should always sit up in bed and even sleep sitting up, at least between 45 to 90 degrees. Try not to lie flat. So whatever little bit of gaseous exchange you can achieve at the apices or the upper parts of your lungs, you will be able to achieve this. The second thing that I've asked my patients to do is breathing exercises, or pranayama. And what this does is it helps to hyperoxygenate your lungs naturally and blow out carbon dioxide. So it's very simple. You can use your thumb and your ring finger, lock your right nostril with your thumb and your left nostril with your ring finger. You breathe in for 1 or 2 seconds, hold for 2 seconds, and breathe out for 2 seconds. Breathe in for 2 seconds, hold, and breathe out. Okay. And if you can do 10 to 15 of that twice a day, it helps to expel excess buildup of carbon dioxide. Because what happens is the patients start developing acidosis based on, that means excess acid builds up in your body based on the amount of carbon dioxide that you retain. By blowing off this extra carbon dioxide, you allow more oxygen, because the carbon dioxide and your oxygen are competing inside your lung. If you can get rid of more carbon dioxide, then you get better oxygenation. And remember, there is also fluid that's building in your lung that's preventing exchange of oxygen. This is why your oxygenation falls lower and lower, and eventually you tend to slip into a coma. There are mudras or hand gestures that actually benefit because they channel energy into your lung area. So I will be going through a series of mudras in a few weeks, which I will teach online, also for free. And you can practice these to help you expel excess carbon dioxide from your lungs as well. So in terms of nutrition, people shouldn't be given heavy meals. So curries and large amounts of meat, etc., are not beneficial to the patient at all, because a lot of the energy goes into the digestive process, and the person needs to spend most of the energy breathing. So soups, stews, largely of vegetable origin, are better. They're healthier, they're more easily absorbed, they're easily digested. Then there's been posts out there about steaming. Steaming is very good. So you can inhale steam with a bit of eucalyptus oil, or you can use menthol, the famous Vicks, in boiling water. So inhale steam twice a day. This also helps to clear excess secretions from your lung, and it promotes the absorption of oxygen through your lungs into the bloodstream. Now, going more for further natural foods, in Ayurveda, you can use garlic for fever. So if you develop a fever, chew a clove of garlic. Your breath is not going to be the best, but at this point, I don't think you'll care. And try and that will help you naturally. Of course, you must, or you should use also Western medicines that are out there for you, like paracetamol-based medicines. If there is a lot of pains and aches, you can also use anti-inflammatories. Initially, anti-inflammatories were regarded as a no-go zone in coronavirus, but the recent evidence shows that anti-inflammatories do work, and my own experience is that anti-inflammatories do work and do help the patient. So you can use Brufen or diclofenac for your body pains as well as for fever. Raw ginger is really good at battling viruses and inflammation in your system. So you can grate up ginger, squeeze out some juice, try and make a tot of ginger, and have that twice a day. It burns, but it's very, very useful. If you have a cough, irritating cough, you can add some nutmeg into that. So the other natural food that boosts your immune system is raw onions. Raw onion is also virostatic. It helps to reduce fever. It also protects your body from the influence of viruses. So you can cut up some raw onion and add it to your food. And it doesn't taste too bad. The purple onion is best. Cut it from stem to stem into fine shards and mix it with your food or make salads with it. So there are also those of you that have learned yoga, Surya Namaskar helps and benefits you, gives your body a certain protection. There are certain asanas as well, like the lion pose, which are very beneficial. Regular chanting helps bring up the vibration in your body, as well as the practice of Kriya Yoga. Now, I spoke about statistics earlier, and why I don't pay so much of attention to statistics. There are many of you that are obsessed with statistics. Remember, the more you look at stats, the more that you're focused on such things, the more negative your thinking becomes. Because there's no positivity in that focus. And many, many people, I think, ultimately succumb to this illness because they give up or they've just overwhelmed themselves with negativity. And this is a great, great chance for you now to have positive thought. And positive thought is your best friend. So the power of positive thought cannot be emphasized, because it's those that think positively, that believe that they're going to be better, that are prepared to fight, are the ones that do well. The ones who think, okay, and sometimes it is such a nature that negative thinking attracts a negative outcome also. And, there is a great need for help out there. What is it that we are doing to help? What is it that, and everyone can help, because if there is somebody out there that has coronavirus or a family that has coronavirus, why have we got into such a selfish mode that we don't think these are our friends, these are our family, these are people that need us. Let's make a meal for them. Let's make them a wholesome meal and deliver it. There's no harm in that. We should go out there and try and help more people that have coronavirus, that we should be able to talk to them over the phone regularly, that we should be able to uh, make them feel that they're not alone, that they're not lepers, that they're not, because even when somebody has coronavirus and they try to integrate back into society, people treat them really poorly. People don't want to talk to them, or they're afraid of them, or these people are no longer contagious. They've had the condition and they're out. So it doesn't mean that they should move around without masks, because you can get coronavirus again. It doesn't mean you are completely immune once you've had coronavirus. But regardless, it's time for us to actually serve people more. It's not just because I'm in this profession that we have. I mean, it's our duty to be out there serving, but it doesn't mean that you only serve in your profession. Also, the service is at all times to everybody, and it's important that we go out there and we help people. There are people right in your vicinity that need help. They're your own friends that need help. Cook them something, talk to them. And then there are people that have lost dear ones. Entire families have been destroyed. I mean, can't you feel that, being there for somebody helps to fill that void. It helps them to realize that they're not alone. Because this condition is such that you don't have time to say goodbye. You don't have time to even mourn properly. You don't have time to even do your traditional rituals for somebody. It's teaching you to just be, in a way, detached. But at the same time, the people who have gone through much trauma do need help. And help is not always food. Help is not always money. Help is just being there, letting people know that you are willing to be of assistance. Okay, sometimes you think, okay, this person is very sick, and if they get coronavirus, they won't make it. And it isn't true. With this new strain of virus out there, people that have been completely healthy with no underlying medical conditions have done very badly. So there's no way to predict. We can only say these people have a greater chance of doing badly, but there's no hard and fast rule with that. So coronavirus, to most people, I would say 98% of people, have looked at this past year and I've looked at the virus in a very negative light. And of course, you have every right to, especially if you've lost loved ones, etc. But there are certain balances that have been redressed in the world. And you have to look that coronavirus in itself has brought a recovery into nature. Plants and nature and animals are recovering. We've started to treasure and value life, our own, as well as the lives of those around us. We've started to value family more. You've had chance to spend more time with your family than you have in years, in maybe decades. And you can be with your loved ones, you're talking more often to them, you are able to now spend time in introspection. It's time for you to look within. Even if you have been a victim of loss, it's time now to look within yourself. What is the purpose of life? Why are you here? What is it that you really, really need to find out? It's these times of great tragedy, these times that everybody is under stress, that life starts to have more meaning. Because remember, your life here is temporary anyway. Death is inevitable for all of us. Whether we die of coronavirus or we die of something else, that is going to happen. We all will just be here for a very, very short while. So what is it that we do? So coronavirus, in a way, is reminding us that the quality of our life is important. How do we spend that time? How do we use the time wisely? So what do we become? There are two types of people that I've loosely classified during this coronavirus epidemic. There are those that profit from coronavirus. They profit from deaths. They profit from the supply of equipment, and they profit from various things during this time, even if they are black market selling alcohol or cigarettes or whatever. But coronavirus for them is a grand way to become wealthy. And then there's those that are out there to genuinely help their fellow man. And I hope that this brief overview of coronavirus, how it works, what its impact is, gets you to the point of wanting to be that second person, that you are the one that is not going to sit back, but you will do something to help. It goes against sitting at home and being safe, yes, but you'll sit at home and be safe most of the time. But every now and then, when you're called upon, be of help to somebody else during this time. So, oh yeah, I almost forgot. In India, we're talking about, they've suggested Ayurvedic treatments. They're looking at black pepper, tulsi, ginger, and cinnamon mixes. That's by the national government of India, by the way. So different governments, different countries are approaching things differently. I feel here in South Africa that we should not just focus completely on waiting for the West to save us, because they're at a loss, I can tell you now. Most of the physicians that I've encountered and the doctors that I've encountered working out there are guessing and trying anything and everything to see if something works. And even when the patients get better, it's not the drug that got them better. You know, there's other things that have influenced their recovery. So how do we prevent ourselves from getting there? And I hope this short discussion on change in lifestyle will help you to that extent. But I'm happy to entertain any questions about coronavirus in general and about some of the things that you're encountering on social media as well. So please, if anybody wants to ask a question, you can just raise your hand or unmute yourself and start talking.
Chakradhara Nanda, this is Driti here.
How are you?
Thank you. Well, I'm glad to see you are well as well. You just mentioned this mix that they have in India of the black pepper, tulsi, ginger, and I think it was cinnamon.
Yeah.
And I'm wanting to know, do you think that's a good thing?
Yeah, for sure. I think it's an excellent mix of natural components. They're using it as a preventative thing.
Yes, I understand.
Yeah, so it's a good mixture. I think if from my experience, just using the raw ginger daily or twice a day is fairly beneficial. But you can add things in like black pepper and cinnamon and ginger as well.
And the tulsi.
The tulsi as well. Yeah, that's holy basil you can use also.
Yes, that's right. Thank you.
Okay, great. Yes, Sandhya?
Jai Gurudev, how are you?
I'm well, thank you.
I just wanted to ask if you could give some insight on the rapid tests that are now being available to people from public sector versus the testing.
Yeah, the rapid tests are quite inaccurate because they are antibody based. So the actual gold standard for testing is still PCR testing, which involves swabs. So with the rapid test, you're going to get a whole lot of false negatives. Sometimes you do get false positives as well, but largely false negatives. So the rush to get results out is not always the best thing. I think we should use the best methods out there. And PCR testing is still the gold standard the world over.
Okay, thank you. Just wanted to speak about that.
There's lots of you here. Ask, please. The more questions you ask, the more we can go through things. Or if you want to share an experience, you may as well. Nobody? Everybody happy? Let's see. Maybe I'll have to find somebody. Mute yourself and speak if you need to at any point.
person.
Okay, I'm going to unmute you. Huawei Y7 2019. There we go. You have a question?
Hi, thank you for having this program. I've actually tested positive, and I've got my results 2 days ago. And it's not a good experience. I really don't know how I did get it. And for me, that's not the point. The point is that I need to fight this now. At the moment, I am isolated at home. I'm on vitamin C, multivitamins. I think it's ACC 200. I'm on pain medication as well because the upper back pains a lot. I think it's more to the lung issue. But I'm having a lot of herbal stuff. I'm inhaling a lot. But it's been like 5 days now since I've had the symptoms. And it's not much of a breathing thing, but there's a pain in the chest when you inhale. So, I have a medical problem with my nostril at the moment. I cannot breathe from my left nostrils at all, in or out. So I'm basically left with the right nostrils for oxygen purposes. But it's a bit of a struggle. I won't say, but it's quite a bit of a struggle. It's a strain on family as well. And I'm very grateful. God has given me a wonderful family. My son's taking care of me. I'm at home, isolated. My husband's disabled. He's in the next room, of course. But basically what I wanted to actually find out is that this drink that I'm making with my son's making it with the lemon, ginger, it's got turmeric, and it's got clove. But the thing is that after I'm drinking it, because I'm asthmatic as well, so I'm having an asthma reaction after that. Is there something that can lower it for me? Thank you. Sorry, I took up so much of your time.
No, there's not at all. The reason your asthma is being triggered is because of the lemon. Okay, so lemon triggers asthma. So the lemon should be left out. Just use ginger and nutmeg for you.
Oh, okay.
Yeah, and you can add a little bit of black pepper in there, it's fine. And you'll find that just the raw ginger actually has anti-inflammatory effects, and it will reduce your wheeze quite a bit. The other thing you can do is, because your nose or your nostril is blocked, is you open your mouth wide like this, and you breathe. I don't know if you watch Star Wars anytime. You're like Darth Vader, okay? You got to breathe, sit straight, and you must breathe like this.
Okay, I'm going to try that.
Push the air out, you'll push out a lot of carbon dioxide from your lung. So you do that about 10 times, morning and 10 times in the evening. It'll boost, and then you'll be fine. You should be fine. Okay, try that, what I've said, and we'll see.
Okay, thank you. Thanks.
Okay, so we got some other raised hands. I think, Meryl, if you can help me find those raised hands, and we can get them.
I was speaking to a doctor from Joburg. Huh? I was speaking to a doctor from Joburg.
Yeah.
Mogi, you there?
I was on Zoom for more than an hour now. He had a program on the COVID. And then I told him I tested positive, and then he's not got a problem with my nose. He's teaching me how to breathe. 10 times in, 10 times out. But my mouth must stay open all the time, because at the moment my lungs is not getting enough of oxygen. That's why I'm getting all that feelings in my toe.
Okay. So we don't eavesdrop on a conversation. Okay, so Mogi, you there? You can unmute yourself if you want.
What is that?
Okay, you're unmuted now, Mogi. You can talk.
I think I'll do that now.
Oh, who did I unmute? Hello? Please unmute on your side and you can chat. There was 4 hands raised. I'm not sure who they were, but.
there,
Jay Gurudev, how are you?
Yolanda. Good and you. So
I'm
at the moment, my husband's sister is has COVID, and she's asthmatic, so she's struggled breathing at home, and she was taken to the hospital a few times, and her oxygen levels then dropped, saturation dropped down to 80%, and early hours of this morning, she is now at Chattermed in ICU on a ventilator. So that's where we are with her right now. We're all trying to be positive and send her family, positive thoughts. And, I gave her like Om Namo Narayana to chant before, she was on a ventilator and she could talk. And many other things. But obviously the worrying thing about it is that she's asthmatic. So it's a harsher, event of trying to breathe through everything. Yeah.
Yeah, look, it's this is the reality of what we're talking about, is that this virus has come to visit everybody, differently, and we've all been expected to adjust. So in a way, this whole discussion was to prepare everybody for how to deal with these kind of problems. How do you approach them? Yes, the natural remedies are one part of it, but how do you approach it from a mental point of view? Because a lot of it is psychological. The amount of psychological damage that a family undergoes, that the person themselves undergoes being in hospital, or having this being affected by COVID.
Yes.
There's many people are depressed for a long time thereafter, because sometimes you don't recover immediately, you're sick for months. So, sometimes, when you get to that stage where somebody's on a ventilator, the best thing we can do at that point is pray for the welfare of that person. And, it's going to take an intervention beyond what the doctors are able to do for you right now.
Absolutely. But we are remaining positive that she will get off the ventilator and fight it, for her family's sake, for her kids' sake, And we are, you know, chanting and doing what we are supposed to do as family and sending a love and light. So
Yeah, many
it's all
people
we
do.
can do now.
So let's pray for her as well.
Thank you.
Okay, take care, Selina.
You too. Thanks. Bye.
Yeah. Okay, Rishav, looks like there.
Yeah, Jai Gurudev. Good evening, everyone. So it's been almost a month now when I actually tested positive, but just over a month in fact. So I've literally been out of hospital for the last week. So it's been quite a journey. So basically for me, I had went in initially on the 3rd of December to one of the hospitals. At that time, there wasn't really a need for me to be admitted. So we waited a few days, and then on 2 or 3 days later, on the Saturday, my wife basically, she realized, you know what, I'm not improving, and I had to get readmitted. Admitted. So yeah, that was the beginning of it. In hospital in the normal COVID ward for a few days. And then after about 2 or 3 days, they had to move me up to high care because there wasn't really any improvement. And yeah, so basically my, what would they call it? The oxygen levels and when you're doing the blood gas test and stuff wasn't improving as well. So I was on, I'm not sure what the machine exactly is called, but it was pretty much over CPAPs. I can hear my wife screaming. It's a CPAPs machine. So for about close on to 2 weeks in high care. During that time, pretty much, I think if I slept at any given time, 15 to 20 minutes in a stretch, it was something. So in 2 weeks, I pretty much didn't sleep. They gave whatever they thought was the best medication. It was probably about at any given, 3 times a day, there was about 9 to 10 tablets. Basically, the point I'm trying to make is, as Chakradhara alluded to earlier, your medication is going to do so much. Your vitamins, your zinc and whatnot that they give you. The main thing that pretty much got me through everything was my mindset, or what I've been taught over the years and things like that. So obviously, like I mentioned, I hadn't been sleeping. So as soon as it got to about 3 o'clock, 4 o'clock in the morning, the sun would come out. I'd start to pray and meditate. He mentioned the mudras. I would use some of them that I learned over the years. He mentioned the Kriya and the breathing and the pranayamas. That helped me a lot, pretty much every day. Yeah, look, for me, like he also mentioned, there's, in terms of medication wise, look, the doctors and research guys are doing the best they can, but at the moment they're pretty much, in terms of treatment, clutching at straws. So for me, what made the difference was that. So it was the breathing exercises, the meditation that I've been taught over the years. And in terms of my mindset and stuff, what I've learned over the years from himself and from my guru's teachings, that's what helped me. Yeah, sorry, the 2 weeks that I was in high care is a bit of a blur at the moment. But what I can just urge everyone in terms of prevention, whoever you meet, in terms of your family, your friends, it's not a joke. You'll get the odd few people with mild symptoms and they'll run around after 5 days and be fine. Unfortunately, not everyone's going to be so lucky. Just to give you a rundown, I'd like to think I'm a young person, so I'm 31. Physically active all my life, cricket, squash, bodybuilding, whatever have you. And I still ended up in high care for 2 weeks. So yeah, it's not a joke. On top of that, both my parents ended up in in hospital. My wife ended up in hospital, her mom and dad. So it was a bit of a challenging time for the family. So it's not a joke. So as many people as you can meet, urge them, stay at home as much as they can, keep their social distancing up, sanitize, clean, do what you can. Just, yeah. Did I miss anything? Okay. Yeah. So for me, the biggest part that saved me from day one. So I got in there and I've got major sinus problems and stuff. So this big tube was strapped up to my nose and forcing oxygen at like 37 degrees or something. And literally, and then I started to fight with God. And then I'm like, why is this happening? What did I do? Then literally I heard him ask me, like, what did you do? Like, what did you do on your whole life? And then I'm like running through everything I've done in my life. And then he's like, was it really you? Or was it, him guiding me or him showing me the whole way? And then I thought about everything that has happened from my whole life, literally from like 5 years old, to buying a car, to everything, even to the point where I'm at lying there in the eye care. And the truth is, we don't really control too much in life. We think we do, but yeah, it's literally, it's all him, and it's everything we do, we should do for him. For me, that's why, look, as painful as the experience was for me, I don't really regret it. For me, it was quite, you can say it was life-changing. And I'd like to think I came out a better person, but we'll see how that turns out. But literally, I owe my whole recovery to my Sadhguru. That's Paramahansa Vishwananda. Look, whoever you pray to, whoever you feel close to, this is your chance to change and build your relationship with your divine, or whatever you may call them. But yeah, for me, this is the purpose COVID is. Yeah, whether you can think I'm crazy or what have you, but yeah, for me, that's the reason. I know my wife and I always make a joke, and we're like, yeah, this is Mother Nature teaching us a lesson. And the truth is, I think everyone can relate. If you do something wrong, and if your mother gives you a a big slap, you tend to come right very quickly. So for me, this was that happening for me. And yeah, so sorry, I'm blabbing now, but yeah, that's all for now. I don't know if anyone wants to share anything else.
Yeah, thanks for that, Rishabh. I think the important thing to note is, as much as the lesson was there, that when it all happened, the timing of it was very important for you. 3 weeks later, the circumstances are very dire in hospitals now, and to get a bed and to have the level of care that you enjoy is not possible anymore. So you were taken care of right from the beginning. Okay, so who's next, Mel?
Good evening.
Hi, good evening.
Okay, I just got a quick question. My mom tested positive and she has some difficulty breathing. She
Right.
is asthmatic. So it's some things that can help us to get our oxygen levels up.
Yeah, as I was explaining earlier, is one is the raw ginger. It does help. The second thing is to do breathing exercises, the pranayama, which I showed earlier. But I'll just recap for those of you that missed it. Is use your thumb and your ring finger, block your right nostril with your thumb, breathe in through your left nostril, block both nostrils, release your thumb and breathe out. Breathe in again. Plug both nostrils, release your ring finger and breathe out. So your process of breathing in, holding your breath, and breathing out through your alternate nostril is 2 seconds at a time. And so basically that's what you do. You can do 10 to 15 of those breaths morning and evening. And what that helps is it helps to drive out all the excess carbon dioxide from your lung as well.
Thank you so much. Thank you. And would the steaming help with that?
Yes, steaming does help. You can use eucalyptus oil in your steam or menthol, which is Vicks. It does help as well. I will put, Meryl will share my cell phone number on the chat. You can take my number down and keep in touch with me if you like, because I'll be going through a few mudras and breathing exercises as well, which are relevant to coronavirus over the next few weeks, which I will teach that online to you.
Okay, thank you so much. I appreciate that.
No problem, thank you.
Namaste, can you hear me?
Yes, we can hear you.
Namaste, good evening, everyone. Thanks for this Zoom meeting. I really appreciate that. I just want to find out that if you show signs or have some symptoms and you went to a doctor and you felt there was no need to go to the hospital, but on the doctor's advice, you self-medicated at home, did what you were supposed to do. And after about 14 days, you felt comfortable, you were well, you were breathing, which of course you were not doing that earlier on, and you are back to normal, virtually about 98% or so. Now, the question I want to ask is there a possibility that there could be a relapse, where suddenly you have breathing problems again, and you go into some sort of difficulty, like you're going backwards? Will that happen?
Okay, invariably it doesn't happen. Your recovery also, once you get to a certain point, is linear. The only time that it would happen, that you're breathing, you have breathing difficulties or you become worse, is either you have been infected again, or you've got underlying conditions and something's been triggered. Maybe your heart's been pushed over the edge and your heart started to fail. Maybe some of your organs have been damaged and these organs have started to fail. You could have secondary viral infections that could cause that. The flus, there's 123 different types of colds. All these things can affect your chest. And of course, you can get bacterial infections or pneumonias that can be opportunistic at this point because of secretions in your lungs. But invariably, most coronavirus patients, if they reach day 14 and they have improved, then it's very unlikely that they will actually relapse. They might have a nagging cough that can go on for weeks. And if you do have that cough responds well to steroids. It responds well to steroid inhalers as well. Symbicort or Flixotide, all of those asthma treatments, actually, they work very well to restore your lung to normal at that point.
Okay, thank you very much. The last question I want to ask, Doc, is from your point of view, maybe you mentioned this earlier, I could have missed it. What 3 or 4 things that a home must have at this stage, the essentials, before you phone the ambulance or before you rush to the hospital? What should you keep at home? Besides what you already mentioned, I'm talking about checking your oxygen level and so on. What are those things that you need to keep at home, the essentials now?
Look, many people have invested in things like, thermometers, that's not really necessary. Some people have oxygen SATs meters, which they're using at home as well. But again, that's not necessary. I think the biggest thing that you need to keep at home is common sense. If you're feeling unwell, don't wait around and think you will get better. If you're feeling unwell, go and have yourself checked. Either get to the emergency room or get to your doctor and let your doctor assess you. You've got a medical professional that can look at you and see with what equipment they have available, whether you require further intervention or whether you'll be fine. Sometimes you feel unwell because you dehydrate. So you might just need a drip to get your hydration better, or you haven't been nourishing yourself well enough, and then you feel better and there's nothing more for you to be done. Not everybody needs oxygen. Not everybody needs to be on a ventilator. So I think try to refrain from making a medical decision at home. I think what you've done always is that when you're unwell, you got to a doctor. I think leave it at that for now, rather than trying to, and this is one of the reasons why we never encourage asthmatics to have nebulizers at home, because what they do is they keep nebulizing, think they'll get better, and many people actually die on a nebulizer, an asthmatic who has these home nebulizers. So it's better not sometimes to have certain things, because remember in coronavirus, it's same like the spiritual world. A little knowledge is far more dangerous than no knowledge, because the person with no knowledge is always wanting to ask. The person with little knowledge thinks they know everything, and it can be really, really detrimental to your health in this case. So rather assume the position of, you know what, I don't know too much, let me go and find out. So that's what I would suggest for home.
Okay. Thank you very much. That was very useful. Thank you, and all the best to everyone over there. Take care.
Thank you. Do you have anyone else, Mel? Santosh? You can unmute.
Jai Guru there, Chakra, thank you. I had a question, but it's already been answered, I think. Thank you very much for this. The question I was actually going to ask was, worst case scenario, if hospitals are at absolutely maximum capacity, and we ourselves or loved ones are battling to get oxygen in, our oxygen levels aren't that fantastic. Is there any other means of sourcing an oxygen tank or anything like that? Worst case scenario. And administrating.
Worst case scenario sometimes is you have to make peace with your maker, I think. But we don't want to get there. Look, there are some organizations out there that are supplying oxygen cylinders. There are some individuals that are supplying oxygen cylinders. So if you can get oxygen at least, then you got some chance. But really speaking, try not to get to that position where you are very sick. Intervene early, introduce those measures that I've said early, and you should really get quite far without needing to be sent to a hospital, because you do not get anybody doing those things for you in hospital. And by then you're too weak to do much of this yourself as well. So that's why I try to cover a lot of this about what you can do at home, not about what's going to happen in hospital. Because the thing is, and when most of the patients, and I'm having this fights now regularly with doctors, is that when most patients get to a hospital, that's it. The family don't even hear about what's happening to them. They don't take the time to phone each family and let them know what's going on with their loved one in the hospital. And as you know, you can't enter the hospital. It's not allowed. So it's like that person is all alone. And sometimes if, somebody is really very, very ill, and there's a good chance that they won't make it either in a hospital or at home, where do they go? Do they stay at home or do they go to the hospital? Because remember, in the hospital, your last moments are quite alone. You're not around family. It's a very, very tough call. I can't give that answer to anybody. But you all have to be vigilant and just, remind people if they're unwell, rather go and have yourself checked. Don't assume that you will be better tomorrow and you will be better the next day, especially when you take a downward trend, because it can be too late sometimes. And at this point, no amount of money, no amount of being on, not having even the best medical aid is going to help you, because there's just no beds and you can't get in at any cost. Unfortunately, it is really difficult. So the only time you get in is when somebody drops dead in a hospital or they are discharged. Then there's a bed available, but there's a queue of people waiting for that same bed. So please try to be very, very vigilant and try not to get infected, but use these general measures for now.
Thank you. Thank you so very much. Thank you.
And Samantha, I think, was one more. Or did Samantha already ask? Samantha, are you there?
Jai Gurudev Swami.
Jai Gurudev, how are you?
I'm much better. I think just to inform everybody that's listening, I was tested positive, and I think for me, one of the most important thing, I think, is to have somebody that can be there by you. Sometimes, like what you may say, Dr. Jeevan, you say Chakra, Swami, these people are there to save you. At first I had a wheezing issue, and the second time when I went to see Swami, I realized that this is not looking right. And knowing that he knew by that time I had the COVID-19, but he still treated me as a patient. I think that's one of the biggest highlights in my life. Sometimes we may take it lightly, but at that point in my life, when you treated me, you really saved my life. I came home, and it was difficult, but I've been through that stage. I think I'm about day 10, but I am healing. I still do have the nagging cough. I think the greatest thing is gratitude to people around you, my wife, the children, and yeah. I just want to say, Swami, from your side, a big thank you for healing.
Thank you, Ashan, at least for sharing. So as you see, many people have been affected, and many people have recovered. So that's the most important thing. We're trying to prepare you to recover. There was one last thing that was raised, which was about retesting. So remember, you do not have to retest, and companies shouldn't insist that you retest. I think the person who raised that question needed to retest because they needed to travel out of the country. But generally, you do not need to retest. Companies should never insist on a retest. The reason for that is that if you retest, your test remains positive for many weeks after you have recovered, once the virus is even no longer in your system. So it can be up to between 3 to 4 weeks later that you still can be testing positive, although you are virus free. So this is not a policy, and this is not something that should happen. So if you're well at day 10, you can integrate back into society. Some of you will take longer, so that can be up to 14 days. But my advice is to go back to the doctor, those doctors that are prepared to check you, even if you are COVID positive, and go back to the doctor and have yourself assessed, and he'll give you, or she will give you the all clear to integrate back into society. So okay, there's another question. Yes, so that's it. As I said, it was an airline requirement because of travel, but really speaking, corporates should not ask you, like if you're working for, I don't know, like if you're an educator, for example. So where it's a requirement for travel, you should do them, because even if you have to travel to Dubai, I think you have to do 2 tests before you go, and some other countries as well. So yeah, so one person has asked about having onion. It's giving her a stinging feeling in her nostril. Is it normal? It can. You don't have to have too much of onion. The purple onion is less astringent, so you can have that purple one, and you can mix it up with feta. You mix it up with your food. Don't have it on its own like that, and then it's more palatable and less stinging as well. Some of you. Okay, so Mogi asked about lupus. Lupus and autoimmune patients. So it's strange. There is some research going on now with autoimmune disorders, and it's found that those patients that have autoimmune disorders and that are on treatments for lupus and rheumatoid arthritis are actually doing better than those patients that don't have this condition. And it's believed that this might be due to the fact that there's the anti-inflammatory response of the medication that they're taking helps them. So really, for those patients that have those autoimmune disorders, I think stay on your medication. And of course, you can use these general measures that I've suggested, these natural ways of treating it or preventing yourself from being infected to help protect yourself from infection. Okay. Don't know if I've missed anything before I go. Okay, so my cell phone number is 082. Meryl has put it up earlier, but I'll just mention it again, 082-452-6283. Please feel free to ask me anything that you want to via WhatsApp. I can't always take a phone call because when we're busy at work, it's insanely busy with coronavirus now. And I'll try and assist you to the best of my ability. Those of you that are wishing to participate in an online Mudra course, then you can also message me and let me know your interest. So I'll register you. And we'll start that within a week or so. Oh, there's another question. Okay, so a family member tested positive and recovered, but there is still no taste. Yes, sometimes that is normal. Sometimes the recovery of the taste can be quite some time. Depends on how much of compression happened on the nerve. So because the nerve itself has to recover. So that loss of smell and that loss of taste, which is associated, can last some time. You can try using some B12. Neurobion is very good injection to take even weekly during that time to help hasten the recovery of that nerve. Okay, so is there nobody else or nothing else? Oh, there's another question, sorry. Okay, someone asked about a baby. Now, the fortunate thing with coronavirus is that the children, the kids seem to do extremely well. We very rarely have an infant death or, poor outcomes with infants. they seem to just breeze through this condition and are pretty well. So if you have a young kid, I think just to carry on making sure that they, you know, have the necessary nourishment, and everything else will take care of itself. We are very, very rarely treating very, very ill kids. I've only seen, in the last few weeks, I've seen one who had a respiratory problem and they were 7 years old. But by and large, most children actually just don't have a problem with coronavirus. Okay. Okay. Right. Okay. Meryl, right. Meryl, I'm waiting. Ask.
Chakradhara, thank you for this session. It's really informative. So my uncle told me that the doctor told him that he should be careful and not get infected with coronavirus again, because he had it the first time, because this time it's much more stronger once you get reinfected after you first had it. And I wanted to know if this is true. And he said that it's more likely if you get it again, you won't survive it. And also I was having a conversation with Michael one of the days, and he told me that what they're discovering that when you get corona, even though you recover from it, it triggers other illnesses. And I've noticed, like my uncle, when he had it and he recovered, he ended up having meningitis in his brain and he had to go for further treatment. And even my other uncle ended up with a stroke. So I want to know if that was true also.
Well, it's true. Meningitis you can only get it in the brain and nowhere else. So that part is true, but the rest of it, look, if you do have an infection and your immune system is terribly compromised, so the likelihood of, you know, if you get infected a second time, having a poor outcome is high. And it's happened that many people have probably been infected with coronavirus, have had a very mild condition, which they didn't even know they had. And the time when they do badly is the second infection, or perhaps even the third one. So at each time your body is being compromised, you're not recovering fully, you're not recovering your full strength. And that's why I'm saying these natural treatments are very useful, because they help you to recover your full strength quicker. Now, in terms of strokes, it can happen. It depends what underlying conditions your uncles have had. Meningitis can happen because of opportunistic infection, especially if it's a bacterial meningitis. You do get viral meningitis, but they very rarely kill you. Bacterial meningitis, yes, can happen because your whole system, your whole immune system is compromised. So yes, when you get coronavirus, it's not that you're immune after that. You want to be extra cautious because it can have worse consequences the second time around. You get a very weak immunity towards coronavirus.
Okay, thank you so much. And one last question. My brother and my sister-in-law works in Belito Mall, so they are in the core of everything because they had 22 shops that were closed down and re-sanitized. But currently he has the flu, he has the cough, he's looking like he's got flu symptoms, but should he go get tested, or when would it be like he should know that he should get tested, because he's suffering currently with the flu and we don't know whether to tell him to go get tested or just wait it out and see until things get worse or something.
Okay, from all that you've heard now, what do you think?
It's hard to tell because it's so different for each person.
Look, he's been in a high risk environment. Many people have tested positive and he's there and he's got symptoms. He should test. There isn't a question there. He should definitely get tested because of the fact that he has been in an area where he's potentially exposed. Please do not treat anything as a flu, especially if you've been exposed or potentially exposed, and do not treat it as a flu until your doctor tells you it's a flu. If your doctor feels it's a flu maybe. Even then he might be wrong. I'm not seeing a lot of flu right now. We're seeing a lot of coronavirus. So people have flu-like symptoms. And one of the things that happens is that the cough is generally is a bit dry rather than a wet cough, although you can sometimes get a wet cough in coronavirus towards the latter part of it. But initially it is a dry cough. It's one of the distinguishing factors. But please, you know, the flu, a lot of people die of the flu every year, actually throughout the world, but not at the rate that people are dying of coronavirus. So, and the thing is with the flu, you can go and infect somebody else with the flu, it's fine. But you should never be out there potentially infecting somebody with coronavirus. That's where I said, you know, it becomes negligent if you do that, because, you know, you shouldn't go to work, you shouldn't interact with anybody until you are absolutely positive you don't have coronavirus. Because, as I said, you might survive, somebody else won't be so lucky. And that's because of your negligence. You've actually, and if you willfully did it, then that's something you have to, if you never know about it, you will get to know about it at some point. But, you know, if you willfully did it, it's not a good thing to do, to willfully go out there and put other people at risk for your own gains. Yeah, so I'm not attacking your brother, but I'm just saying generally this is the situation, and I think he should go get tested for sure.
Thank you so much.
Okay, so the child is on Simplex, which is selenium, zinc, and vitamin C. Look, multivitamins are good, as is iron, as is many things, but an excess of vitamins in your system is not necessarily good, because your system is expertly designed by somebody quite great. It works, you know. So if you want to supplement with a multivitamin or with those things, you can do it once or twice a week. And excess of it only results in overeating, increased appetites, and then it can affect the digestive system. So ulcers are commonplace, diarrheas, gastric disturbances, electrolyte disturbances, skin disturbances. There are side effects of taking too much of vitamins also. And remember, none of these things are actually foolproof, because if they genuinely prevented something like that, then the World Health Organization would have issued a bulletin saying that if you take these things, you definitely will be prevented from getting this ailment. So even like you take the flu vaccine is even 90% effective. It's not 100%. So 1 out of 10 people who take the vaccine will still get the flu. So even potentially the coronavirus vaccines that are coming, I can't see that they will be 100% effective, especially since we're dealing with a new virus out there, or in inverted commas, new. I'm just, sorry, those of you that need to eat and stuff, I understand. There are some few other questions coming through, which I'm just going to wait for. In the meantime, if you have, please just put your hand up and ask, or type it out to me. It's fine. You know, recently I treated a patient who came into our emergency department at 3 o'clock and was admitted by one of the doctors there because he was having problem to breathe. We only managed to get him an oxygen point. He couldn't get to a ventilator, and he couldn't get to anything else. And by 8:30, I had to certify him, you know. And as I walked into the room, he took his last breath. I tried to do some resuscitation on him, but we limited in the amount of resuscitation we can do on a COVID patient without exposing everybody in the ward. And he didn't respond to that. And, you know, he had, from a very wealthy background, he had everything materially. But at that point, he didn't have, the money couldn't buy him his last breath. So please understand the seriousness of the condition. It is very serious. It's, as I said, many of you have beaten it, but some won't. And it's the sum that we want to make that number smaller, so fewer people lose their lives. Is there any question, Joshua? Okay, so you see, your natural system is designed to fight this virus. And the reason why it's not succeeding is because of poor lifestyle. It's because of poor eating habits. You know, we haven't looked after our bodies properly. So that, because if your body is actually looked after properly, and you practice all these breathing techniques, these different yogas, this proper wholesome eating of you know, very healthy foods, then your body is in tip-top shape to fight any condition. But because of lifestyle, many people are succumbing to this condition now. Okay, so I think that's it. I don't have any more questions here. And thank you all for tuning in. I hope you went away with at least one or two decent pieces of information and that you can implement. And well, I wish you all the best of health, and that you and your family members are all kept safe by God's grace, and that we'll weather the storm, and then we'll see the end of coronavirus in a few months. Okay, so take care and